BNC, America's Black News Channel. Watch 15 minutes. Share with everyone. Finally, news that speaks to us.
This week, the CDC announced it is finding an uptick in the traces of COVID in our wastewater across the U.S. It comes as the country is shedding the mask and easing the pandemic restrictions. So how should local leaders use this information when it seems to conflict with what the CDC is saying on virus prevention? Dr. Maria Elizabeth Ramas is a family medicine physician, and she joins us this morning from New Hampshire. Dr. Ramas, thanks for being with us. The CDC captures wastewater data from about 650 sewers. That's about a quarter of the U.S. population. How critical has this data been in detecting the virus early on so that we can prevent the next wave, that seems to be gripping parts of Europe already and also Asia?
Thanks for having me again. So, one of the things that we're trying to figure out here in this new era post and in the process of COVID is how can we be more nimble in our response and preparation for COVID surges. Certainly in other areas of the world, we're starting to see remarkable rises again of COVID variants in alarming rates. So I think that looking at wastewater is an opportunity for us to detect the virus before people are actually showing signs of infection. And that can certainly help get insights on communities that may not have access otherwise to testing.
Dr. Ramas, we should always point out that when we are talking about any uptick in COVID, it will affect different populations in this country in different ways. This is not your grandfather's COVID, where nobody had a vaccine, no one had any immune response because they got the virus. So even if we see these upticks, are we talking about people who have the shots and have been boosted getting sick and possibly dying? Or are we talking about the unvaccinated still facing the same risk that they faced more than 2 years ago?
I recently had this conversation last week, actually. So, one of the things with COVID is that we don't know what we are going to expect with new variants. What we do know is that those who are vaccinated have a better protection against adverse effects and death. But we also have patients in the population who are immunocompromised, who do not have the vaccine. And of course, they're going to be at higher risk of having death or other long-term complications from infection. So we need to make sure that we are staying on top of our monitoring, and things like wastewater surveillance, and with the CDC's National Wastewater Surveillance System, that might give us more intel to prepare more readily for our populations that are most underserved.
Dr. Ramas, we are seeing European countries now saying that they may have to go back to the draconian measures that were first introduced when COVID became an issue. We're seeing China now going towards lockdowns in some major cities. Are we headed towards the same here?
Oh, if it looks like a duck, it's quacking like a duck. Unfortunately, we have to take the experience of our neighbors across the pond. Honestly, we've talked before about how are we going to create a new normal in the midst of COVID. One of the interesting things that I'm trying to look at as a physician in counseling my patients and thinking about from a public health standpoint is not only how many cases are rising, but how many hospitalizations and subsequent deaths are we looking at in these new surges. COVID is going to be with us long term. We're going to have to learn how to deal with this at least for the next 2 or 3 years, to be honest. And so the question is how can we best protect ourselves? How can we be more nimble in detecting higher surges in areas of populations that are in most need? And how can we ration and leverage our resources in the most judicial and efficient and effective way? And I think that we'll be seeing this emerge over the next couple of weeks.
You probably couldn't see me wince, as you said, if it looks like a duck and it quacks like a duck, it's a duck. But yeah, that was a wince on my part. I am not ready for anything that resembles anything other than our experts coming on the air and saying, it's over, go out there, take your mask off and run naked through the streets. But that is, of course, Dr. Maria Elizabeth Ramas. As always, Dr. Ramas, thanks for being with us.